Bonjour pour qui fait joindre nous. Aujourd'hui, dans Topik Konversasyon, pareil, moi dit plus bonheur, nous joignons avec Dr. Eric Licea, qui est General Surgeon, qui aujourd'hui nous pour cause le bonne défaillance, qui nous-mêmes nous voit difficulté avec nous les corps et les temps nous guette nous, pareil nous fait, c'est tout bon madame, les temps nous guette nous dans la glace nous dit comme si mon petit ça bout, mon get ça. C'est tout le temps nous bonne, pareil nous dit en anglais, accumulated fats là, qui nous envie tirer bonne bout. Et justement aujourd'hui nous avons un docteur qui pour bien capable causer avec nous, qui fait sa bonne opération. Aujourd'hui nous cause le cosmetic surgery, nous cause aussi le endoscopic surgery, la laparoscopic surgery. Aussi nous pour tous un petit gain, le breast reduction, breast augmentation. Et si le temps permet, nous parlons aussi un petit peu le buttock reduction, un petit peu de tout qui bonne l'opération que Dr. Eric y fait. Et justement, aujourd'hui, nous interview, il pour en anglais, mais au qui de la coupe à casser, envoyez-moi un texte en créole, moi, va translate lui pour docteur, il va répondre aux questions. Est-ce que vous êtes capable de faire en anglais pour bon encore? N'a pas de problème avec ça, pas besoin de casser, on nous fait lire, on nous texte, on nous cause, on nous téléphone aussi, pareil l'habitude, faire lire le numéro de téléphone 4 28 97 64 et sur le texte nous faire lire le D 52 01 70 et pas oublier le temps peut texte nous pour mettre des ZS devant au texte pour nous capables de recevoir au texte et n'a pas discuter nous aborde ça qui ou les causes là. Dr. Eric, good morning.
Good morning, Carol.
How are you?
Very good, thank you.
Welcome on the platform. Happy to be in Seychelles. How long have you been in Seychelles?
Well, I started working in Seychelles in 2006 as a general surgeon at the Victoria Hospital.
With the Ministry of Health?
With the Ministry of Health.
So you've been to Seychelles before that?
Yes.
Okay.
I know Seychelles well.
Oh, okay then. So now you're here to visit with Dr. Muti?
Yes, I work here actually with at Dr. Muti's clinic. We offer our services there.
Okay, so let's start. We will touch about endoscopic surgery. What is it really?
Okay, it is a surgical technique. It is not a different type of surgery. It's the conventional surgery that we have been doing for years, 100 years. Now we are doing it in a different way. For instance, we used to do conventional cholecystectomy to remove the gallbladder when it is sick through a huge incision, approximately 10 to 15 centimeters. Laparoscopic surgery means that we do the same procedure but through thin incision. So the damage to the abdominal wall is less.
So what is the difference between laparoscopic and endoscopic surgery?
The difference between conventional surgery, that is the surgery that is done here mainly, and laparoscopic surgery is that to have access and a good view to the organ that we are going to work with, we have to do a large incision. Opposite, in the other way, when we do laparoscopic or endoscopic surgery or keyhole surgery, the same is the same. We do through small incision. We create channels to put the instruments in the abdomen. So we create a chamber to put a camera to have a good view and access to the instrument, working instrument. That's
so you have to go with the camera.
Yes, that's the only way to go.
Surgery.
The camera and the hand instruments, yes. We do the same procedure, but through thin incision with camera to have a good view and the instrument so we can work.
But the keyhole, it's known as the keyhole as well.
That's
so
why they call it keyhole surgery. We do incision that the size is 3 to 5 millimeters, no longer than that.
Mm-hmm. But tell me, you don't have to cut anymore. You just have to press a hole in the body?
That's what we do. We don't do large incision anymore. And this has a lot of benefit because the recovery is faster. Patient can go home almost, in 1 or 2 days, and sometimes even the same day can go home. Recovery is faster. He can go back to normal life faster. Complications, we used to have more complications initially because it was a new procedure, but nowadays it is as secure as the conventional surgery.
But who recommends the endoscopic surgery?
Well, the laparoscopic surgery, endoscopic surgery can be done for all patients. It is not there is only a single indication. Patient who needs surgery can have it. Conventional surgery, it means open surgery or laparoscopically. So it is a procedure that can be done in all patients.
Not only oversized person?
No. When we do laparoscopic surgery to obesity patients, It's just to treat as well the disease. And by the way, we do it mainly in obesity patients because it is safer, with less risk and less complication than when we do it with open surgery.
How high is the risk?
As I mentioned before, initially it was high because it was a new technique, so there was a learning curve. But now we do this every day, so doctors now are skillful enough, and the risk percentage is similar to open surgery.
Mm-hmm. Does it bring any complication?
Yes, of course. All medical procedure may have they have risk, and a patient may develop complications. Even a small thin injection can damage a nerve, a vein. You may have infection, hematomas, and laparoscopic surgery as well. But nowadays it's a very safe procedure, and by the way, the view and the access is better than with conventional surgery.
So in a day, how many laparoscopic surgery can you do?
It depends. Sometimes we have long procedure that can last 4 or 5 hours, but with laparoscopic surgery as well, even it can be done faster, so we can do several procedures. But this is a case-by-case scenario. Mm-hmm. Depends.
Let's talk about tummy tuck now. It is very common in women, especially women from when after birth. They give birth, they have the accumulated fats in the bottom area here. So when the woman come to you, not every people come to you, it can be oversized weight people, it can be very slim people, they come for a tummy tuck. What is your first advice? What do you do?
Well, first it is important that this type of cosmetic surgery, it is not a treatment for obesity, okay? There is another treatment for obesity, but it depends. Some patients, it is feasible to do a tummy tuck. Some other patients, we have to do other procedure. When there is fat accumulation as well, what we do usually it is a liposuction combined with tummy tuck, so we can target all the problems.
Mm-hmm. There is accumulated fats here. How come what does you have to remove it and then you have to reseal it?
Yes, when we do tummy tuck, we do a large incision in the suprapubic area, and then we have to excise all that skin below the umbilicus. So we have to reshape the abdomen and then reposition the umbilicus. That's what we do. Then we tighten as well the muscles to reshape the body. That's what we do.
Mm-hmm. Once you've done a tummy tuck surgery, doctor, can you do it again in a year? Huh? Can you do it again?
No, it should not be done that often because the wound is still fresh. Healing lasts or takes a year. You can see that the wound is sealed, but the healing keeps on going for a whole year. So better, usually what we advise when we do this type of procedure, we give nutritional advisement. Nutrition recommendation, because patient will put on weight again, will gain, yes, that not the fat that we remove because it was already removed, but there still can develop some fat deposit. So we usually advise how to eat, to introduce as well for sport activity, physical activities. It is important. Automatically,
it will change your lifestyle as well as your diet, as your food. So once you've done the surgery, what do you recommend the patients to do?
Well, our recommendation, as an international recommendation now, is to eat small portion of food at least 5 times per day. It is important as well how you combine the food. Usually the recommendation is for instance, to eat fruits and vegetables 5 times per day. It is a mistake. We should eat vegetables 5 times per day, fruits once or twice per day, because fruits has a lot of sugar on it.
At what time should we eat the fruit?
We should eat the fruit around 5 to 6 p.m. because
not in the morning?
Not in the morning, no, because it's when the brain needs sugar to produce serotonin. That is the hormone that gives us peace, happiness. And this is they say the same hormone, serotonin, is a precursor of melatonin. That is a hormone that is going to make us sleep well.
Most of the people tend to eat fruits in the morning for breakfast, so it's not a good idea?
It is not advisable. The best the food that we can eat in the morning is the so-called English breakfast. We should eat protein, carbohydrates, and fat in the morning, not fruit, not only fruit.
And those people who are doing the tummy tuck surgery, do you advise them to eat large portion of food?
No, we advise to eat small portion of fruit, food, but at least 4 to 5 times per day. Large amount of food are not advisable because this will not create a proper satiety and it will disturb the internal mechanism.
Pour justement pour qu'il y ait la cour qui peut regarder nous, là nous peut cause le tummy tuck. Ça c'est l'opération par une voile au portrait avant, l'opération qui nous tire la graisse ici, la côté accumulée, c'est tout bon du monde qui est peu gros, il tente pas accumuler, il tente pour descendre un petit gain et nous peut cause l'opération qui est capable de faire pour retirer ça bonne la graisse, par nous dire en anglais accumulated fats, mais seulement bien si il y en a sans complications, il y en a toute une série quelque chose qui vient avec ou besoin adapter une qualité lifestyle, adapter un système façon manger, tout quelque chose. Alors, pas hésiter pour call nous, pour texte nous, pour demander nous un peu plus l'information, malgré nous interview en anglais, mais seulement nous capables de faire. And doctor, those people who are doing the tummy tuck surgery, does it have to be obese people or oversized people?
No, not at all. We do tummy tuck when there is a laxity of the skin, or the skin has been compromised. So we have to tighten the muscles and resect the damaged skin. You don't have to be obese to have the tummy tuck done.
But tell
By
me,
the way, obesity is not an indication for tummy tuck. For tummy tuck needs nutritional advices, physical activity, and in some cases, bariatric surgery.
do you recommend exercise after tummy tuck?
Yes, definitely, because it is not only because of the tummy tuck of the procedure, because this has a lot of brings along a lot of health benefits. We have to have to be in constant activity, movement. It is very important for health.
And tummy tuck is for both women and men.
Both. Nowadays, more and more men are as well coming into this type of cosmetic procedures and surgeries. It is not a female issue anymore.
It's both. But what
Correct.
causes the excess fats, doctor?
Well, I can tell you that there are some stubborn fat that even if you are not a big eater, you can develop some fat deposit in some areas that they are very difficult to get rid of. But mainly it is due to nutritionally balance. The food is a fuel for us. If we eat, we consume that fuel, and we don't use that fuel, we have to accumulate the fuel. We have to save it. And the way we have to save the fuel is fat. That's why, for instance, we should not eat large portion of food at night. Because at night, after eating and having the dinner, usually we go to sleep. So what is going to do the body with that fuel? It's going to storage. And the way we storage the food is fat.
Can you perform a tummy tuck when the blood pressure is high?
There is no, or there are rare contraindication to perform tummy tuck or other procedures. As long as all diseases are controlled. Patient can be hypertensive, diabetic, but usually we do a pre-op assessment to make sure that everything is okay. If there is any disturbance on the blood pressure or blood sugar level, for instance, patient has to see an internal physician first. It's going to control the patient, it's going to control the blood sugar, the blood pressure, and when the patient is stable, then we can do the procedure with the same risk that we perform the procedure with a healthy patient.
And liposuction, what is it?
Well, liposuction is as well a surgical procedure. It's not only a cosmetic procedure. Nowadays, we do liposuction surgery as well as a part of some treatment. For instance, when patients have lipomatosis and fat accumulation in some areas, we do that as a general surgeon as well, not only as a cosmetic surgeons. And liposuction is that through a small hole, first we have to prepare the tissue, the fat. We inject a solution, we numb the area, and through a small incision, 3 to 4 millimeters, we introduce a cannula, and then we suck the fat out. That's what we're doing for that localized fat. liposuction is not a treatment for obesity. It is important. We can do liposuction in obesity patients, but it is not a treatment for obesity. It is important.
Ou qui dans la cour, pas oublier, pareil, il peut dire, tummy tuck, liposuction, n'est pas un traitement pour obésité, mais justement pour retirer sa bonne excess fat dans le corps. But tell me, doctor, what would you recommend a patient after tummy tuck to eat?
Okay. This is a general recommendation, not only after tummy tuck. We should eat small portion 5 times per day. As I mentioned before, the breakfast should be the so-called English breakfast. It's very good. Breakfast should be the main meal of the day, the more comprehensive.
Very heavy breakfast?
Should be heavy, and we should have a very light dinner. For instance, we should have salad and proteins. Only that. During the day, we're supposed to have as well snacks, and the lunch as well is very important. We're supposed to have large amounts of salad. The more colorful, the better. It means because you have a lot of different minerals and vitamins and nutrients in different type of colors. It is important. So the more colorful the salad is, the better it is. And then we should have legumes as well and protein. This is the way to eat. Around 5 or 6, we should have a unit of fruit and almonds, for instance, because it is a time that the brain needs that type of nutrients to produce hormones that will give you peace and will make you sleep well. If there is a patient, for instance, that is having a lot of craving in the afternoon for sugar or chocolates, it means that there is is lacking of some nutrients that then they are needed to produce serotonin. That's why you crave for those type of food in the afternoon.
We have got a call from the control room. A lady is asking about the price range for the tummy tuck. Would you like to share with us about the price range if she wants to do the surgery?
Yes, it is case by case. We don't have a fixed rate for that. It depends on the patient.
It depends on the size of the excess fat, or?
There are several things that we have to take into consideration. It can be the patient size. If the patient is obese, then we have to add other procedure, or the risk is higher. We have to bring in anesthesiologists, more medications. It is a case by case. We don't have a fixed price, but we are flexible on that. So what we try is to help people, because cosmetic surgery is not only a beauty surgery for beauty, right? Because there is a lot of psychological suffering as well when patients have some anestheticism. So it is important to keep in mind that this is not only for beauty purposes, but as well it is health.
It's for health. But during your times of doing this surgery, have you get patient who has done tummy tuck surgery who has returned to you with complications regarding it?
As I mentioned before, there are a risk of complication in every medical procedure. Okay. With tummy tuck is a huge intervention as well. We may develop surgery complications, but there is a protocol. We follow steps by steps, and usually we don't get complication. But we are ready to detect early complication and treat it, and so we can sort it out. But
so
there are risks.
What kind of if it happens that there is a complications, what do you do?
It depends on the type of complication. The most common complication after tummy tuck, for instance, is fluid accumulation. So it is very easy. We can do tapping with a needle syringe, remove it, or we can open a small opening on the wound so we can drain the fluid out.
It's not that risky?
No, not at all. We can sort it out easily. As well, we prevent complication during the procedure and after the procedure. We send the patient home with antibiotics, painkillers. We use as well a compression garment to prevent complication and as well to reshape the body, because it's important as well.
We have got a text, doctor. Say, good morning. What is the cost for tummy tuck, and is it done in Seychelles? That's one. And the other one, it's about the same. They are asking about the price. What is the cost to have a tummy tuck and liposuction? So this is the two texts we've received so far. It's about the cost range. People are very interesting to know. They want to do it.
As I mentioned, well, we are offering these services at Multis Clinic. Okay, we work there, and the cost, as I mentioned, it is case by case scenario. We don't have a fixed price. But what I can tell you that it is cheaper that if you go overseas to have the procedure done, because it involves traveling. Most of the time, you need somebody to go with you, a companion. You have to pay hotel. You have to pay the food there. So if you add all that cost, the price of the procedure is going to be higher if you have to go overseas. And there is no need to go overseas now because we are doing that here with the same rate of success. And I can tell you it's cheaper than going overseas. We are doing that procedure here with the same cost that it has overseas. But when you go overseas, you have to add on that the price of traveling.
Pour la cour qui peut texte nous, qui peut nous ban prix, qui peut téléphone nous, justement, Dr. Eric est là, ici c'est celle pour des oiseaux, et basé quand Dr. Mouti, quand tu es capable d'aller pour prendre une consultation aussi, non, faire une surgery, dépend de où qui a besoin, mais seulement il a besoin d'aller pour voir le corps, pour faire étudier, pour les guetter, qui est nécessaire. Il y a de nous un peu de consultation, un peu son opinion, un peu avoir décidé from là pour que pour faire, mais seulement pour là, le moment, il coûte Dr. Mouti pour les capables de prendre un bon conseil. Nous avons un petit call aussi pour les capables de prendre un bon conseil et regarder. So, Doctor, still about the tummy tuck. I'm very interested in that because it happens in women, because maybe I'm a woman. So, when after, because I know very rare Seychelles do tummy tuck here, but I know one woman who has done it. After that, like 4 to 5 months, she was having many complications. She did not do it here in Seychelles. She was having many complications. I don't know if it was the upper skin was too, lift down was very tight to the bottom one, but she was having quite a bit of complications. She even have adverse side effects. So what do you recommend?
Well, that's why we do a pre-op assessment. It is important. And as well, it depends how we do the procedure. But as I mentioned, there is always risk to have complication. But we follow protocols. We have been doing this for a long time, so we follow protocol, and usually we don't get complications. And as well, we are very aware of complications that patients can develop, so we usually follow the patient, do a close follow-up. So in case of there is any complication, we can target the problem and sort it out.
But when those people do the tummy tuck, the surgery, after eating tons and tons of chocolates and all these greasy foods, they do the tummy tuck, and they can go home, no complication, everything okay, 6 to 7 months. After that, you saw them again with another big stomach. So,
having this type of procedure will not prevent you of gaining weight. It is important. As well, it is not a treatment for obesity. So if you keep on eating the way you're eating, you will put on weight again, you will gain fat. So this is the advice we give. You have to change your habits. It is not a diet, because diet means as well temporary. So we have to delete that word from our dictionary. We should not think about dieting, because it means, okay, I'm going to change my food or the way I eat, and I will do exercises for 3 months. And after that, will you go back to your previous routine? It is a mistake. So we have to change habits. We have to do the proper way all the time, all our life. It's not only because you have the procedure done. If you keep on doing what you were doing before, you will gain weight. Again, that's for sure. And we cannot keep on repeating this surgery, because there is no skin.
It's very risky.
Of course, because there is no skin to stretch down, because we already removed a large portion of the skin. We cannot do it again.
So when these people come for the surgery, you already told them that?
Yes, we usually give them this type of advices, that this surgery is not to lose weight, and this surgery will not prevent you of gaining weight, of gaining fat. So it is very important, because we cannot be blamed later on for that, because that's what usually happens. You remove the fat, and then patient put on weight again, and they blame the surgeon. No, this is they have not changed their habits.
You are what you eat. So
that's
you come for
yeah. That's it.
That's what I say. You are what you eat. And bariatric surgery, the difference between?
Okay, this is another type of surgery as well. Bariatric surgery, it is a surgery that is, we use it to make the patient to lose weight. It is not a cosmetic surgery. It is surgery usually that is performed in very obese patients. And it is not connected to the skin or the fat. We work into the bowel, stomach and bowel, to reduce it. There are several techniques for that. We can reduce the size of the stomach, make shortcuts, so we reduce the food nutrients absorption, so the patient will lose weight. But it's not a cosmetic surgery. And it is a surgery that usually have a lot of risk.
Lot of risk. It can be fatal?
Yes.
Really? How much did you get?
Well, nowadays, in good hands, the rate of complications for in bariatric surgery supposed to be 1%.
1% fatal?
No, complications in general, 1 to 3%, and fatal can be 0.5 to 1, approximately.
We've got a text, doctor. Good morning, Carol and doctor. Can a woman do breast reduction or lift after giving birth at least a year ago? We will touch breast reduction soon. Breast reduction and breast augmentation, we're going to touch it soon, so just give us a minute. So we will finish with the topic first. Thank you for your question. So the women are very concerned here. So we're going to touch breast reduction after that. So we were on bariatric surgery.
So, as I told you, this is a procedure to lose weight. This is not to lose fat. It's just generally to lose weight. And it implies as well preoperative assessment. A patient will usually be seen as well by a psychologist because there are some problems or disturbances that has to be modified as well, because having the surgery only is not enough. That's why we have to bring in healthy habits.
So let us touch off another cosmetic surgery. We will talk about the face now, facelift. Some women, I will touch women because it is common again in women, some women in their old age, they tend to have flaggy skin that comes down and they want to do a facelift. So you've done it many times. So what is the procedures for it?
Okay, let me tell you first. Nowadays, more and more men are coming into this type of surgery.
Really?
Yes, and not only when the woman is older. We are doing this even in patients that they are 40, 45 years old. So you don't have to be that old to have the procedure done. Aging is not only, or does not only imply aging of the skin. Okay, there is bone absorption, the fat part as well, dislocation. So that's why the skin and the fat is saggy, and that's what we do. We restore that anatomy. That's what we do. We have to tighten the muscles, excise that excess of of skin, and that's what we do. We do facelift. We treat the eyebrow, the eyelids, the cheek,
and upper lips,
the jaw, everything. The neck is very important as well.
I know some people who use anti-aging cream. Is this the solution? Is this the answer?
Well, it helps, but it's not the solution. The skin is a barrier, okay? That's why we don't leak out. It is dry, even though we have a lot of fluid inside. So on that way as well, when we apply a cream, rarely we get something in. So those expensive creams, usually they don't work well. The only thing that works well is the protection. When we use sunlight protection with cream and as well a moisturizer. There are some creams that they can work well, but they are really expensive because it needs a career. That's why I was telling you that the common cream doesn't work. This is not the solution. And solution for that, better is healthy habits, healthy nutrition, physical activity to protect from the sunlight, and to visit. What we are recommending now is even to visit a cosmetic surgeon or a cosmetic doctor early in the early 30s, so to reduce or slow down aging and not to wait when you are 50 or 60 to start getting procedure done. So we recommend that. 30 years, we already started, for instance, doing Botox, fillers, so to try to restore the face anatomy.
Mm-hmm. So it's not a good idea to use the anti-aging cream. They are not, basically, they're not doing anything for the face.
There are some creams that they may help. Some creams, but they are very few. And if you are going to use a face only, a cream as an anti-aging, what you should use is sunlight protection and moisturizer at night. That's all. But cream really, it can help, but this is not the solution. You will have a healthy skin if you have a proper nutrition. If you take vitamin C, for instance, it is better. Vitamin A. If you drink a lot of water every day, you should protect from the sunlight.
From the sunlight.
It's more important than the cream.
So sunlight is also a main culprit for the skin?
Yes. There is a normal routine aging, where we get old. But there are two factors that create really or accelerate aging. It is smoking habits and the sunlight. So I can tell you, if people decide to protect from the sunlight and stop smoking, we have, as aesthetic doctors, we will lose 50% of the business. So that important it is.
It is. Okay. But what we say smoking, what causes the aging in the face? The smoke?
Well, there is a lot of toxic and cancer components in the tobacco. But it's not only the direct exposure to the tobacco that causes or accelerate aging. It is the toxic that we inhale when we consume tobacco. The problem is that to get rid of these toxins, we need the body use the vitamin C that we have in the body, our reserve of vitamin C. And vitamin C is as well what we need to repair the skin. And the body is very wise and will prioritize getting rid of toxics instead of having a healthy skin, because it is more important for the body to be free, to detoxify, and the body will use the vitamin C reserve on that. So you will age faster. That's for sure. You see, you compare a person that smokes with a non-smoker, you will realize that that person ages faster. It's because
tell the difference.
that person is burning down the vitamin C reserve.
You can tell the difference between a person who is a non-smoker and a person who is smoking. You can.
Yes, by the skin.
So we've got another text, doctor, regarding tummy tuck. Can someone still get pregnant after tummy tuck?
Well, can get pregnant because when we do tummy tuck, we do not
touch
compromise the female organs. We don't go inside the abdomen. Patient can get pregnant, but we don't recommend to get pregnant after tummy tuck, or we don't recommend tummy tuck if the patient has not have a pregnancy.
Why do you not recommend?
Because during pregnancy, there is the uterus is going to grow a lot, and the skin is going to get stretched, and it's going to compromise the result of the surgery. So we better advise the patient to have the pregnancy that she wants to have, and then to have the procedure done.
After that. Ou qui de la cour qui envoie nous sa texte, par le docteur dit, il est conseillable pour faire aux enfants d'abord, après là, on va faire ou tummy tuck. Il n'est pas conseillable pour faire tummy tuck les temps, pareil, ou question in demander. Alors, faire aux enfants, après là, on va faire ou surgery tummy tuck si nécessaire. And doctor, we have another text. What is the solution to double chin in women? Double chin.
Okay. Nowadays, we go more for a minimal invasive procedure. So it can be done through surgery, or as well we can do with other material like we can use Botox, but sometimes it is linked to muscles contraction, and as well we use fillers.
I was asking if we do fillers, it's a chemical, do you feel it?
Well, it is a product, chemical product, but nowadays we use very safe products that they have to be approved, but they have a FDA approval and as well CE mark, so they are safe. Nowadays we don't use any more permanent fillers, permanent products. It is forbidden in Europe and almost in developing countries mainly. And the disadvantage is that patient has to go back to the doctor, but they are safer. So the rate of complication is less. In the past, doctors we used to use silicone, for instance, as a fillers, and they have a lot of complication, and we're still seeing a lot of patients with complications due to the silicone filler. So nowadays we use fillers, but they are not permanent; they are temporal. So we can, if there is any complication, we can sort it out.
So the patient can go back after how many months to refill?
It depends on the filler we use. There's some filler like hyaluronic acid, for instance, that it may last 6, 8, 10 months. And we have other fillers that they may last longer, 14 months, 16 months, and sometimes even 2 years.
Okay.
Depends on the filler.
It depends on the filler. Okay. So you touch every part of the face for cosmetic surgery, for the facelift?
No, it depends. Sometimes when the patient has is that the eyebrow is low, and then we lift only the eyebrow. If patient have saggy backs, then we work on that.
But, eye contour.
But usually what we recommend is to work the whole face, so patient will benefit more, but it depends. It is a case by case scenario.
Ok. Ou qui est là, faut espérer ou peut bien comprendre ou on a l'intérêt de tout ça qui nous peut dire. Par exemple, là nous parle Tom le Topik qui ou pas quand encore là, mon si man petit intéressé là nous parle cause un petit gain le bon breast reduction, breast augmentation, qui sont complications, tout ça là nous parle voir là avec docteur. Now we're going I was saying to the audience, now we are touching the famous one, breast reduction, breast augmentation. Doctor, very common in women again. Which is more popular, augmentation or reduction?
It depends on the country. For instance, in Seychelles, it is more common that patient has a giant breast. That is small breast. Yes. So here the demand is more for breast reduction. And breast reduction, as I mentioned before, cosmetic surgery is not only for, it's a beauty surgery. Usually that patient with a big breast, they have a lot of suffering. They have neck pain, shoulder pain, back pain, and even they have even a skin infection. So there is a lot of physical pain, not only emotional pain. So it is important to take that into consideration.
We go back to that text which was asking about breast. Now we say, can a woman do breast reduction or lift or breast lift after giving birth at least 1 year ago?
Yes, it can be done. It should not be done early because the breast is still enlarged and the breast duct still open, so patient can develop sometimes complication. But it can be done safely after a year with the minimum risk.
If a patient wants to do a breast augmentation, how far will you go? What size will you go for it?
Well, it depends. Usually we have to get to an agreement between patient and doctor. But this is difficult as well. Some patient wants huge breast. We don't recommend that. It depends on the body size, body shape that we recommend the patient. But as well, if patient wants a bigger size, sometimes we tend to do it. But it is not recommended to have it should be in relationship with the body.
A very sensitive part of the body, the breast. How high is the risk for a breast augmentation or reduction?
There is risk implied on all type of surgery, and this type of surgery specifically has his own risk. Like,
does it promote breast cancer?
Well, there is a lot of discussion that breast augmentation promotes breast cancer, but it's only discussion. There has not been proven that there is any increase on the risk of developing breast cancer. But what I can tell you, 100% sure that breast reduction reduces the risk of breast cancer.
Really?
Yes.
But what about breast augmentation?
No, as I mentioned, there is a lot of debate on this, okay? But it has not been proven. There is not any serious paper, research, investigation saying that it increased the rate of breast cancer. If the implant breaks, it may develop complications, but it has not been proven that
it has not been proven yet.
No.
Okay.
No.
Okay. So we were going to show the viewers at home a little video about the breast cancer. Pour qui de la cour, nous pouvons passer un petit script qui m'a il fait sa breast reduction ou bien sa breast augmentation. On nous suit.
Known as a breast lift. Here we will examine the steps of an anchor-style mastopexy. Orientation markings are first made on the patient, marking the incision lines as well as the new areola position, making sure to preserve symmetry. An incision is first made around the areola, sometimes reducing it in size. This nipple areola complex stays attached to the breast tissue and is merely shifted upward at the end of the procedure. Further incisions are then made along the anchor markings on the breast. The skin between the anchor incisions is then excised. Any bleeding is stopped with cauterization. The new skin edges are then brought together and temporarily stapled in place. This reveals the approximate shape of the new breast. The hidden nipple areola complex is then pulled through the skin edges and into its new position. Once the surgeon is pleased with the position and shape of the new breast, the nipple areola complex is sutured in place and the open skin edges are closed with sutures.
Ou qui de la cour, qui ne voit ça, si on a une question là, qu'on voit qui m'a fait, n'hésitez pas à hésiter, texte-nous, ou bien call-nous, envoyez une question et n'agitez si le docteur est capable de répondre aux questions. Doctor, I was watching this little video, quite serious surgery here.
It is. Especially because when we do breast reduction, there is a risk of bleeding because usually when you have a giant breast, there's a lot of vascularization. So it is a serious procedure as well. It may have complications.
What kind of complications?
The most common complication is this type of procedure is skin or wound infection. The wound is opening, wound healing problems, but this can be sorted out. Mm-hmm. I mean, it will not cause. It will not go further than that. Just a skin problem, and we can sort it out. During the procedure, yes, a patient may bleed, but it is we can sort it out easily during the procedure.
Mm-hmm. So after the breast surgery, it can be augmentation or reduction. The patient needs to come for checkups?
Yes, and the patient will need as well to use a special type of bra to help to reduce the pain, inflammation, and to reshape the breast. It is important. And there is a protocol that we have to follow. The patient has to come back for follow-up, independent on the type of surgery. And as well, what to do at a post-op recommendation. It is already written down, and so patients have to do the follow-up at home as well.
And they have to sign something, the patients, when they're doing the surgery?
Yes, they have to sign a consent.
Mm-hmm.
They have to approve the doctor to have the procedure. We have to explain to the patient. It is in the consent. All the complications. Usually we have general complication for all type of surgery and a specific complication for this type of surgery. And all is written. It's a different type of consent for each type of surgery. And we have to discuss that with the patient, and the patient has to sign that. At the same time, the patient has to sign that she is getting, or he is getting, because we have a male patient as well, a post-op recommendation document with all that he has to follow up at home.
Mm-hmm. But tell me, to do a breast augmentation, you use a chemical for it?
When we do a breast augmentation, what we do is we put an implant.
Implant.
Yes, the implant, the shell, can be plastic, and we feel during the procedure, we fill the implant during the procedure with normal saline, with water, and then we get the size that we want. Or this can be a silicone implant that we make a pocket in below the muscles, and then we put it there safely. But they can develop complication as well.
I was going to ask you that complication, yes. But as far as you've been a surgeon doing the breast reduction, have you got any patients complaining and then come back to you complaining about there is pain in the chest, in the breast itself?
Yes. All surgeons will get complication. It is not true that doing any procedure we can get complication. And the more you do, the more chances you have to have complication. But at the same time, the more you do, the more skillful you will be. So usually, with practice, you see patient with complication, but usually you will see less and less patient with complication. The most important complication on this type of procedure is asymmetry, because we are asymmetric by nature. And when we are doing the procedure, sometimes we can get some type of asymmetry, or we cannot restore normal asymmetry. This is the most common, but this is not that bad. And a serious complication is capsulectomy, because sometimes the body rejects the implant and creates like a capsule, inflammatory capsule that produces a lot of pain and suffering in the patient.
But what happens if, I will say a woman, because I am a woman, if a woman who have just done a breast augmentation, something happens, she fell or she tried to squeeze her breast with something, does it cause pain? Well,
the breast is very sensitive. Even if you don't have a breast implant and you hit the breast, it is painful. Mm-hmm. And, but it is rare that, I mean, there is no risk, rarely, that the implant is going to burst because you hit the breast. It rarely will happen that. But if you have the procedure and you have a trauma to the breast, definitely it is painful. But it should not go further. Probably you should not develop complications.
Mm. I'm going to text doctor. He said, what are the side effects? And can he just give a price range? We've talked about the price range. Vous avez côté docteur Mouti là. Aujourd'hui même téléphoné passer ou grand au price range. Mon point question. What are the side effects, doctor? She didn't mention specifically what kind of surgery, but she's asking about what are the side effects, basically all on the surgery. Let's say we are on breast reduction, breast augmentation. What are the side effects?
Well, usually there are no side effects. What, as I mentioned before, patient may develop complications, but side effects rarely will have side effects. Nowadays, implants they are very safe, and they have been. We have been using the same type of implant for for a very long time, and complication rate is very low. That's why we can do it, but side effects rarely we get.
It's rare. Mm. How sure can you be? How sure can you be on the side effects?
Well, I cannot tell you 100% because it doesn't exist, but it is very safe. I can tell you that. That's why we recommend to do it.
Mm. Okay. So I want to ask this question. I've been meaning to ask this question before the patients come to you, before they want to do that. I don't know if you ask the same question. I want to know, do you ask them why do they want to do a breast augmentation?
We have to ask that question to all patients coming for cosmetic surgery or aesthetic treatments. It is important because there are some patients with has some psychological problems that the name for this is dysmorphia. They don't see themselves properly, I mean, a beauty, or they have this problem, that perception problem. So it is important because if that's a problem, they will never be happy with what you do. Even with what you do. So it is important. They will never be happy. So you have that patient complaining all their life. So we have to ask that question.
Okay, so what did they say?
Some patients, they really need breast augmentation because they have a very small breast. Some patients want that even because the job they do. And for reductions, it is, I mean, you can see easily what is the problem with they have giant breast and they have a lot of pain, neck pain, back pain, suffering, wound infections, I mean skin infection. And then you do the reduction. As well we do breast lift. it's not only reduction or augmentation. It's a woman with normal breast size that the breasts are saggy, floppy.
Saggy, floppy, yeah.
So we have just to reshape the breast. We don't need to put implants, but it depends as well on the size of the breast.
How do you reshape the breast?
It is similar to what we saw in the video. We have to remove to reduce the diameter of the areola, remove some small amount of skin, and lift the breast tissue up and then close the wound. On that way, we can do a breast lift to put the breast back to the normal position.
And for breast lift, breast reduction, augmentation, you were talking about a special bra for that, for the benefit of our viewers who are listening to us, who are watching us now. Where can they get the bra after they do surgery? Is it in normal shops or there is a special shop?
Let me tell. They have been inquired about price. I think they should get an appointment with us, because this is case by case. We cannot give a price because it depends on a lot of factors. The bra or the garment that we use for after liposuction and tummy tuck, it is a medical device. It is a medical type of garments. So you cannot get this, not even in the pharmacy. They may have good ones, but not the type that it is needed for the procedure. And we have to take that into consideration. So what we do, we import those garments, and we have it in the clinic, specifically for each patient and the size that it is needed.
And the size as well.
So if they want to get information about this, the price, the procedure that they need, because it is not all the time what patient consider that should be done, what it has to be done. They should get an appointment with us at the Multis Clinic and get all the information that they need.
So now that you are here in Seychelles, doctor, you're here for the surgery or just consultation?
We do both. We do consultation and we do the surgery, both.
Since you've been here, you've got many surgeries until today?
Yes, it is. We are progressing. We are getting a more demand.
What kind of surgeries have you been doing since you're here?
What we do more is tummy tuck.
Tummy tuck.
And liposuction.
Liposuction. Do you do any other cosmetic surgery on any other parts of the body?
Yes, you can do cosmetic surgery everywhere. Face lift, neck lift, the breast that you mentioned before, to tummy tuck, brachioplasty when patient lose weight and then the skin is very saggy. We have to do brachioplasty to remove all the excess of skin, the spider veins as well. It's very common. We treat those conditions as well.
There is one question, a very quite sensitive question, but maybe the people want to ask, but I have to change a word in it. So it says, what about for men? Do they do enlargement for the balls down there, or tuck up or saggy scrotum?
Yes. Now, sexuality is not hidden anymore. It is now very common in our life. So the genital area is an important aspect as well that both female and male are interested in. So we nowadays get more and more demand for cosmetic restoration of the genital area for both female and male. We can do penis augmentation. We can do minor labia or reduction as well for female. We can do as well, for instance, it is very common now, lightening of the perianal region or the genital area. Yes, we get a lot of patients now. This is a huge concern now.
It is a huge concern, but I'm very concerned as well because when you look at it on the whole, you don't have a body which originates yourself. You have to touch on every part and every detail. I don't like this, I'm going for a cosmetic surgery. I don't like my buttocks, I'm going for cosmetic surgery. What about your original body?
Well, we have what we have, but I think it is not a mistake, it's not bad. If you want to change something that is going to make you to feel happier, why not to go for it? I think, yes, if you feel unhappy with the size of your breast, why not? Even if you don't have pain, for instance. Or you don't feel happy with the size of your penis, you're not happy with that, why not?
have to do augmentation.
Yes.
Okay, briefly now, we touched our last topic. We will talk about Botox reduction, Botox augmentation. Is it similar to the breast, the procedures, the surgery?
Well, in the reduction, as the name implies, we remove part of the breast tissue. But the procedure is similar. Okay, we have to do that pre-op assessment that I mentioned to you to be sure that everything is okay, that we are going to have a safe journey during the operation and in the post-op period. And during the procedure, we excise part of the breast and then reshape the breast when we do breast reduction. And augmentation, we create a pocket, so where we can accommodate the implant. So they are different, but similar when we are starting the procedure.
And the Botox?
Well, we have for that here in Seychelles mainly. I have done it here already.
Really?
It is, yes, they request more reduction, Botox reduction.
Reduction, not augmentation.
No.
Unfortunately.
Reduction, we do.
Yes.
It's
Okay.
common as well.
Dr. Eric, thank you very much for joining me this morning for the interview. I was very interested. So did the audience at home. They were participating with us. They were asking questions. They were calling and wanted to know about all these things before they attempt to do surgery. But thank you very much. I wish you a very good day today.
Thank you.
Are you doing any surgeries today?
No, not today.
Oh, not today. Okay.
Not today. Thank you for the invitation, and just want to invite the audience and the viewers, if they have doubts, they want information, just to get an appointment with us at the Murtis Clinic, and we are there to help you and to sort out all your needs.
Voilà, Dr. Eric, tu peux causer nous tous un peu le bon qualité surgery qui Dr. Eric, le temps il a cessé, il peut faire et pour plus l'information, accès à l'information de sa bonne surgery avant l'air ou faire un attempt pour faire surgery. Call Dr. Mouti, ou soit descendre un petit coup, quand Dr. Mouti là même là, ou avoir Dr. Eric, ou avoir ben du monde nécessaire, et ou avoir tout ou l'information qui vous peut donner, pas nécessairement ben qui nous demande nous, qui fait plus l'information, qui est un petit peu plus privé, ou capable à Dr. Mouti pour voir Dr. Eric.